you are not, I want to suggest that if you are not speaking, you kindly mute your microphone so that we avoid feedbacks from interacting with the conversation. So these are some few things we want to observe as we continue. All right, so we thank God Almighty for giving us life and for us to meet, to interact among ourselves once again. To his name be glorified. Amen.
Amen.
And I want this is going to be a series. The anxiety disorders has a number of sub disorders under it. So we'll do up to a point and continue, just as we did for the self-concept series. We are going to also do this for anxiety disorders series. So we may not finish talking about anxiety disorders today. We'll start from a point, we'll continue at a point, and we hope in an hour we should be done for today's segment or today's session. So, all right. And as usual, as we've been doing, I would like to ground my presentation on these Bible verses. And we are talking about anxiety, and it's possible that as we interact now, somebody may be going through a lot of worry, anxiousness, even panics. What we want to encourage you is that you should also remember that there is God who we serve. Regardless of the situation, God will come through for you. So if you read 1 Peter chapter 5, verse 7, reading from the NIV, it says that cast all your anxiety. In some other versions, you say cast all your worries onto him because he cares for you. So God is assuring us that he cares for us, regardless of whatever you are going through, known or unknown. God is assuring us that he's there for us because he cares for us. And in Philippians 4, reading from 6 to 7, he says that do not be anxious about anything. So all the things that are troubling us, the Bible is telling us that we shouldn't be anxious about anything. But in every situation, by prayer and petition, with thanksgiving, let us present your request to God. And the peace of God, which transcends all understandings, will guard your hearts and your minds in Christ Jesus. So regardless of whatever the situation is, present the situation to God and he will come in for you.
Disturbing my meeting.
And then the most assuring over here, Isaiah chapter 41 verse 10. It says that, do not fear, for I am with you. Do not be dismayed, for I am your God. I will strengthen you and help you. I will uphold you with my righteous right hand. Amen. So there is this assurance from God that whatever be the situation, he's always with us. So don't think that you are in that situation all by yourself. I'm very sure as we are here, everybody has one or two challenges they are going through. But this evening, if nothing at all, if even you've not taken anything from our discussion that we're going to have, be rest assured that God is always with you. So our anxiety shouldn't make us lose sight of the presence of God in our lives because he is always there for us. So he said we shouldn't fear. He is with us. It's an assurance that he has given to us. So don't be brokenhearted because he continues to be our God. Amen. So we are talking about anxiety disorders. What is it? What are anxiety disorders? So anxiety disorders represent a group of mental health conditions. So as we said, it's a group. So it's no, you don't have just a single disorder. There are a group of mental health disorders, which in the periods to come, we'll be looking at them one after the other. So anxiety disorders represent a group of mental health conditions characterized by excessive and persistent fear. Excessive and persistent fear, or anxiety that disrupts daily functioning and quality of life. So when it comes to anxiety disorders in general, it's not just about having the fear about something in a day and that entity. These are things that are persistent. They continue. So it's not just a one-time thing. Maybe you heard that there's a snake here, and because you fear snake, you are scared of passing there. After they kill the snake, you are fine, and you don't have that fear again. It's normal to be scared that there's a snake because we know that snakes bite. But this is a situation whereby whether snake has been killed or not, the person has the constant fear that when I pass this place, this thing is going to do me. So it is excessive, can go to the extent that the things that the person will be going through can be affecting his or her daily functioning. So it is excessive and persistent. They can manifest in various forms and can be triggered by specific situations or maybe more generalized. So sometimes what is provoking or what is provoking the person to become anxious or worry or panicking, it may not even be known. That's a generalized one. So the person is worried, the person is scared, but if you ask him or her, why are you scared? What's the evidence behind what you are saying that is making you scared? The person actually doesn't have anything to say, but they are worried, they are anxious. And in some other situations too, there can be a specific thing that is provoking that reaction. So it's, as I said, it manifests in various forms. So it is not only about not having evidence to why the person is anxious or scared, but sometimes there may be evidence, but how the person is reacting and the evidence, they don't actually match. They don't actually match. Like somebody seeing a spider, and based on seeing a spider in a corner, this person will vacate the room and wouldn't want to go into the room again. You see, it looks like it's excessive based on what is triggering the thing. However, you're also saying that it's normal to have some forms of anxiety. It's a normal thing. You may feel anxious or nervous if you have to tackle a problem at work. Maybe even for that, maybe it's the first time you're not too sure of how to do the thing. Your first time giving some assignment to do. You may feel a bit anxious, even especially if the people who are expecting the result are high profile people. You're asking, how am I going to do this? How am I going to do that? So that form of anxiety is normal. Maybe preparing for an interview or being in front of the interview panel. Sometimes that little tickling comes up and it can be normal. If it's about an exam you are going to take, maybe prepared or not prepared. For exams, everybody feels a bit anxious because you don't know what questions are going to be there. Or sometimes it's about making a decision and you're not too sure if this decision I'm making will give me positive results or not. So sometimes some of these things can be normal. And we are even saying that some anxieties can even be beneficial because it helps us notice dangerous situations. So you know that this animal, if this animal bites you, it's going to cause you some health challenges. So when you are seeing that animal coming your way in an aggressive manner, you want to run away. So that fear of the animal coming towards you is beneficial because it helps you to move away from a danger. So sometimes having some level of fear in us is not bad. it's not bad. So sometimes it helps us to notice dangerous situations and focus our attention so we stay safe. Yes, so this is the other aspect of anxiety. It's not always bad, but let's look at what happens here. But anxiety disorders goes beyond just the regular nervousness and slight fear you may feel from time to time. Anxiety disorder happens when, one, the anxiety interferes with your ability to function, how you are supposed to go about to do your daily activities. Because of that anxiety-provoking stimulus, you are not able to go to work, you are not able to even sleep in your own room, you are not able to pass some places to go and do something that you have to do. When these things affect your daily activities, then we are talking about a disorder here. Your reactions are often out of proportion to the situations, which I've mentioned a few minutes. That's overreactions. If your reactions are overboard, we can talk about a disorder over here. When you can't control your response to the situation, whether with evidence or no evidence, you are just not able to control how you are reacting. And then we should also know that children, adolescents, and adults can experience anxiety disorders. And statistics is saying that women are about twice as likely as men to have anxiety issues. Well, maybe some people will say men are more adventurous compared to women, but that is debatable. So, but the research is saying that women are about twice as likely as men to have anxiety disorders. And truth be told, anxiety disorders can make it difficult to get through the day if that feeling of terror is there. Sometimes even coming out of your room as if the whole world is coming after you, that thought alone can make the whole day bad for you. So anxiety disorders, what are some of the things that comes up with it, like in terms of symptoms? Talking about difficulty in controlling the worry, you mentioned that. Being easily tired, because based on the concerns, the worries, you end up engaging in a lot of activities and you feel so stressed out. Irritability, you usually get angry because of the anxiety or the nervousness in which you are going through. People have sleep disturbances when they are anxious. Muscle tensions, you realize that the whole muscles are tensed up. You are not able to function properly. You can't even concentrate. You become so confused and don't know what exactly you have been doing. They ask you a question and you don't know where to start your response from. Restlessness. So anxiety can make one to become so restless and worry excessively. So these are basic things that put people in that domain for anxiety disorders. Difficulty in controlling the worry, being easily tired, irritability, sleep disturbance, muscle tension, difficulty concentrating, restlessness, and excessive worry. So how does anxiety disorder affect our body in general? So anxiety disorders can make people prone to be having these constant headaches. You'll be taking medicines and you're not even getting well. You do all the labs that you have to do. Nothing seems to be there, but the headache continues to be there. Sometimes if you should assess and go further and realize that there's some anxiety-provoking issue there, and you're able to resolve it, that headache may go. So anxiety can bring us headaches. Anxiety can make us feel so fatigued, like we said, easily get tired. So the little thing you do, as if you've been working the whole day, sometimes you don't even do anything, but you feel so tired. Just because of the stress on the mind. Shortness of breath. Some we be panting for breath.
You know what I like.
So breathing difficulties. Sometimes even you may start having problems with your digestion system. So you'll be having these chest congestions, inflammations in the tummy, and you are not comfortable. indigestion. You eat and the whole food seems to be on your chest. Sometimes it may be due to the level of anxiety in which you are going. Shaking or twitching. So the whole body, as if you're having tremors, the whole body will be shaking. Then profuse sweating. People sometimes, the anxiety can make you to sweat profusely. Even under fan, you'll be sweating. Fast heartbeat or racing heart, and even racing thoughts. All these things are possible to make one to have difficulties in functioning, and then sleep disturbances as well. So anxiety disorders can affect us in these ways. So as we mentioned, according to a DSM, so the DSM is the Diagnostic and Statistical Manual. This is a document that psychologists use in diagnosing. So it classified anxiety disorders into subtypes. So as we mentioned, there are subtypes, and based on each of the subtypes with the specific issues that goes on there. So today we'll just be looking at some of them. So under the DSM-5 classification, we have under anxiety disorders, you have the generalized anxiety disorder. We have what we call the panic disorder. We have the social anxiety disorder, sometimes called social phobia. Then we have the specific phobias. You have the agoraphobia, and then separation anxiety disorders. So over the period, we are going to go through each of these disorders one after the other. Today we'll be looking at generalized anxiety disorder, and maybe we may also touch a bit on panic disorders. So let's come generalized anxiety disorder. What is it? Generalized anxiety disorder is actually characterized by persistent and excessive worry about various aspects of life, which includes your work, your health, and social interaction, often without any specific reason. So mostly when you talk about anxiety disorders in general, the first thing that comes to mind usually is the generalized anxiety disorder. The distinctive factor here is that this individual seems to be worrying about everything about their life. The worry is not related to just a specific thing or situation, but this person is worried about things when it comes to their work. There are a lot of worry from that side. Their health, they are worried about issues around their health. When it comes to social interactions, they are worried about those places. Almost every aspect, their relationships, every part of their life, it's like they are worried. So the worry is more general, but not specific to a particular thing. So that's why I say generalized anxiety disorder. The person is worried about plenty things. And then usually, before you diagnose somebody with generalized anxiety disorder, the DSM is saying that these symptoms should be persistent for at least 6 months for you to diagnose generalized anxiety disorder. When it comes to the symptoms, just as the definition mentioned, there is this chronic or persistent worry that is there, difficulty controlling the thoughts, the restlessness, the fatigue, irritability, the sleep disturbances. So, but we are saying that the main symptom of anxiety, this generalized anxiety disorder, is the excessive worry about everyday thing. So the worry is consistent. Almost every day, they are worried about something and worried about almost everything. And these symptoms that we mentioned mostly accompany them. So the restlessness, feeling on edge or irritable. It's like something is about to happen, something will happen. So they are overly alert. That's they are on edge, easily fatigued because of the constant reaction to whatever comes to mind that is making them worry. We mentioned the shortness of breath, heart palpitations, difficulty concentrating, muscle tensions, difficulty falling asleep or staying asleep. Then the head aches, the muscle, the stomach ache, the indigestions, and all those stuffs. Even sometimes it goes ahead to affect the person's cardiovascular system. So their BP starts to dysregulate. So the BPs are always high. Meanwhile, medically, the person is fine, but the BP keeps rising. And we are not too sure why it is like that. They run the necessary labs, cholesterol, fat level, whatever it is that you need to look for BP issues, everything is in place, but the person's BP is up. So we are saying that when there is generalized anxiety disorder, some of these things come up and they affect us. So somebody may ask, what causes it, what brings it about, or what are the risk factors? A number of factors can bring up somebody developing a generalized anxiety disorder. So like most mental health conditions, they tell you that there can be that genetic predisposition or that family history of an anxiety disorder or a family history of a mental health disorder, which might be a likelihood cause for a reason why this person is going through this thing. So in that case, it may not necessarily be the fault of the individual, but genetically or by hereditary, the person picks it up from their parents or from the family. So people can be born with this thing. But one thing about genetic predisposition is that it doesn't mean so far as somebody in the family has ever suffered this or you are predisposed, automatically you too must experience it. No. All it means is that it places you at a risk of acquiring it or getting it. So there are certain with behavior management and some lifestyle put in place can prevent you. So you can be in a family where 2, 3, 4, 5 people are experiencing that. But if you're able to know and you manage your lifestyle properly, it is not automatic that you should experience that. So just that, but it has exposed you. So there's a likelihood that if things didn't go on well, so like there's some of the things we mentioned, maybe if there's some shocking news that came your way, the person is doing alcohol, the person is doing other drugs and all those stuff, and you're already predisposed, this thing can, because you are predisposed, it can trigger it, and you also experience the condition. So it is not always that, so far as it's in the family, then everybody in the family must experience it. At times too, there can be issues of the brain, the neurotransmitters in the brain, which may be misfiring or not properly activated, either over activation or under activation of the brain system. Some parts, either it could also be that maybe there are injuries in some part of the brain or there are cognitive issues, all those things. So brain chemistry, all these things can also place somebody at risk of developing a generalized anxiety disorder. Then the lifestyle, we mentioned lifestyle including stress, trauma, substance use, alcohol abuse, some of those lifestyle, not having time for rest. All these things are capable of leading someone to developing an anxiety issue. Or it could either be some social factors, maybe issues at workplace, among family issues, marital challenges, or relationship issues, financial issues. Maybe you are owing some people, then there are some threats, some trauma, all those things coming together can make an individual prone to and developing some of these anxiety disorders. And one thing is that these causes or these risk factors run through most of the anxiety disorders. So maybe when you get to some of them, you may skip the risk factors or the causes because they mostly fit into these same factors that can predispose an individual to acquiring. So what are the complications if anxiety disorders are not managed properly? What are the complications that may come? What are some of the aftermath effects that may come? So we are saying here that if general anxiety disorders are not managed properly, it can increase the risk, an individual's risk of developing depression or any other anxiety disorder. So from the generalized anxiety disorder, it may go to other forms of anxiety disorder if the generalized one is not managed properly. Substance abuse as a coping mechanism. So people may tend to be abusing drugs, and that can also affect or can compound the issues. Impaired social and occupational functioning, leading to isolation, because based on the things that are passing through your mind about the fear and all those stuff, it start having effect on your work and your output or productivity. So at the end of the day, it will affect your occupational functioning. And sometimes you may even not want to be part of society, so you start isolating yourself. So this is generalized anxiety disorder. Talking about management. So managing general anxiety disorder or anxiety disorder in general. So the first thing which is very necessary is for you to know about the disorder, like we are doing now. Now, at least you are having some little insight or an insight to what generalized anxiety is. So now that you now assess yourself and see your worries. Are you having worries almost every aspect of your life? Maybe you can. So learning about the disorder is one step to recovery. So if you know, it will help you to put in measures to be able to fix it. Then rest or getting a better sleep, having a good rest is also very important. So the relaxations you're talking about are equally important when you want to manage anxiety. Some people, when they are going through these things, they want to rather tend to be using drugs, illicit drugs or recreational drugs to cover or to mask the whole feeling. We are saying that if you do that, it rather compound the whole situation to make it worsen for you. It's going to make it worsen. So don't use recreational street drugs. The red, the tramadol, whatever name you have there, you are saying don't use those things in the name of managing your anxieties. Manage your thoughts, your negative thought patterns, which is very necessary. Sometimes the thing that is making us anxious is really, really our thoughts, how we are thinking. Because if we should analyze the whole thing very well, there is no problem before. But the way we think, our way of thinking, can make us really prone to developing these anxiety disorders. So let's take, for instance, somebody who will always want to overgeneralize or want to jump into conclusions, or somebody who liked reading minds of people, mind reading. So before, as they ask your question, they assume they know what you are going to say. So they sometimes try to complete what you are about to say in their mind. So this person is what he's going to do. Mind reading, for instance, can actually make an individual develop a lot of anxieties. the all or nothing thinking, where your thinking way is fixed on a particular thing. You don't make room for any alternatives. So as I said, this is yes, this is black, this is white, that is it. There are no chance or there's no room for any alternatives coming in there. When one thinks, one's thinking abilities like this, these things can bring about anxiety issues. Let me take in maybe discontinuing positives, where you think that for you, nothing good is there for you. So anytime you are thinking negative, oh, for me, I'm a failure. Oh, for me, I can't pass. I don't know how to do this. I am always is there not for you. When this way of thinking persists, it can make you really prone to anxiety disorder. So you are saying that learn to manage those negative thought patterns, and you'll be able to come out of situations like this. Learn to relax. And sometimes based on the severity, maybe when it's beyond just a normal therapy, medications may help. So there are mental health medication or psychotropics that may be available for you to use. The anti-anxiety medications are there for you to use to manage the symptoms. The psychotherapy, which is the talk therapy, where you are taking through number of sessions, help you to realign your thinking, level of thinking, the things that are making you anxious. The psychologist or the counselor helps to bring you to terms, and then help together you plan how to go about and manage situations. So that's psychotherapy. All this can be helpful. Then helping yourself and self-care as well. Care for yourself. Make good time for yourself. Read, attend holidays, vacations, listen to good music. If you know how to swim, me, I don't know how to swim. If you know how to swim, you try swimming. What you enjoy doing, do what your soul pleases. Okay, all these things can help. Hang out with families and friends. All this can help to manage your anxiety. And some basic tips here too. Regular checkup. So you see, in a part of the world, we don't go to check ourselves mentally. Yeah, we go to the hospital to check our BP, our sugar, and all those stuff. You can equally go and check your mental status. Walk to a mental health facility, walk to a psychologist's office, a counselor's office, and just go through a mental status examination and see how you are faring. Have good sleep. Limit information. Sometimes stimulus overload. There are a lot. If you go onto the internet, a lot of information, and we are processing almost all these things at the same time. And people now, one thing you understand is that there are content generators who want to develop their content to get viewership. So people are saying all sort of things on the internet, and you go and hear from here, and this one is bringing their own perceptions about this one is bringing to a lot of information so if you're not able to filter this information to look between the lines properly, it will go against you, and these anxiety things will start coming. Daily exercise are also recommended, and let us think positive, as we've already said. And at times, get out of your comfort zone or your room, put in some extra work. Friends, as I mentioned, excursions and all of these things can all help us to come out of that anxiety situation. So now I want us to move to a particular disorder. It is not directly in that doesn't follow the DSM, it's on its own. But I just want us to bring some distinction over here. So the difference between a generalized anxiety disorder and what we call acute stress disorder, it may look similar, but they are not. They are different. So that's why I brought it here before we continue with the lineup in the DSM. So there's a difference between acute stress disorder and then that of generalized disorder. They may look alike, but not the same. So when you talk of acute stress disorder, it's a mental health condition that occurs in response to a traumatic event. So symptoms usually develop shortly after the event and can last from 3 days to 4 weeks. Same way, if symptoms persist beyond 4 weeks, then it should be the diagnosis changes over there. Maybe it can go to post-traumatic stress disorder. So with acute stress disorder, the difference between this and that of generalized anxiety disorder is that with the acute stress, there is something that is making the person worried. There is something that has traumatized the person. The only difference is that the reaction may also be blown out of proportion. And the duration, generalized anxiety disorder, you are talking about duration of 6 months. But when it comes to the acute stress, that's what we're talking about acute. So within 3 days to 4 weeks, that's a month, and the person is within this state and bringing up those anxiety symptoms, the person can. So you shouldn't say you are going to wait until the person is 6 months before we diagnose general anxiety disorder. The person can actually fall within acute stress disorder. So to be diagnosed with acute stress disorder, an individual must experience the following symptoms. 1, exposure to a traumatic event, which is very necessary. So the person must have been exposed to actual or threatened death, serious injury, or sexual violence through either direct experience of the traumatic event, witnessing the event occurring to others, learning that the event occurred to a close family, a family member or friend, repeated or extreme exposure to adverse details of the traumatic event, example, first responders collecting human remains, among others. So the point here is that the individual has some connection, some relation with the traumatic event. They have been exposed to it either directly or by learning about it, getting to know about it. All these things can bring the person, cause this trauma or this anxiety for the person. So like a first respondent can be ambulance service worker who go on the scene, an accident scene, and collecting human remains and get back home, and it's like they're having flashbacks and all those stuffs coming through their minds. At that point, the person can be placed under acute stress disorder. Presence of intrusive symptoms. This is another thing that should also be present. There's a presence of intrusive symptoms. The individual experiences at least one of the following intrusive symptoms. 1, recurrent, involuntary, and intrusive, distressing memories of the traumatic event. So repeatedly, the thought of the thing is just coming. Let's say, for example, the ambulance example I gave of the bodies of accident victims. This thought keeps coming into the person's mind. Even in whilst they are not expecting it, those are intrusive thoughts, and they keep disturbing the individual. Recurrent distressing dreams related to the event. They'll go to bed and they are dreaming about all that happened. Not just one day dream, but recurrent, continuous. Dissociative reactions, example, flashbacks, in which the individual feels or acts as if the traumatic event is recurring. So they'll be having flashbacks of the whole detail of whatever happened. Intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resembles an aspect of the traumatic event. And then marked physiological reactions to reminders of the traumatic event. So this intrusive thought about what the person experienced also comes in here. So, and they are unwanted. The trauma that you've experienced, maybe you've experienced a fire explosion, and as you are there, the whole thing keeps reoccurring to you, passing through your mind. Even when you are doing something, the thought comes, it's like you get scared, you get panicked out of the thought that is coming, which are very unwanted thoughts. Negative moods. The individual experiences an inability to express positive emotions So they are not able to become happy. They are not satisfied. There's no love feelings. Their mood is just down. Avoidance behaviors. So they avoid the memories. They try to avoid the memories, but the memory still keeps coming. Only thing that will remind them, they try to avoid them, but those things still comes into memory. So all these things all forms under, if the duration is between 3 days to 4 weeks, we can place this person under acute stress disorder, and some other symptoms equally continue. Exaggerated startled response. So the person will just be there and just panic at once, startled. Difficulty concentrating, hypervigilance. That's the person become overly alert. Irritable behavior and angry outburst. Person gets angry easily. Sleep disturbances. All this can fall under that. So this is a summary of the difference between acute stress disorder and a generalized anxiety disorder, so that we get to know the differences, and then we know why we place these people. So the nature of symptoms, when it comes to acute stress, symptoms are related to specific traumatic events. When it comes to the generalized anxiety disorder, the symptoms involve a lot, excessive worry about multiple areas of life, family, work, social, among others. The duration, as we said, when it comes to acute stress, 3 to 4 days. In generalized anxiety, at least 6 months of the symptoms being present. The triggers. With acute stress disorder, it is triggered by exposure to a traumatic event. But when it comes to generalized anxiety disorder, the triggers may be everyday concerns. It may not be just concerns about everything and not tied to a specific event. The person is all over. So when it comes to diagnostic criteria, requires exposure. So acute stress disorder, then you don't have to be exposed to the traumatic situation. And specific symptoms clusters like intrusive, these symptoms should be present. Intrusive thoughts, negative mood, dissociative, avoidance behavior, and then arousal behaviors. But when it comes to generalized anxiety disorder, talking about based on excessive anxiety and worry, along with the physical symptoms, and then you also consider the duration as well. We've mentioned the common symptoms. So under acute stress, intrusive memories, dissociations, avoidance behavior, hyperarousal. And with generalized anxiety disorder, some of the symptoms include restlessness, easily fatigue, irritability, difficulty concentrating, sleep disturbances, among others. So when it comes to acute stress, because the acute stress is mostly based on a particular trauma, the therapy or the treatment is mainly focused on the trauma that happened that is causing all these things to the person. So you focus on the trauma, that's trauma-focused therapy, and then immediate response to the individual. Then with generalized anxiety, you try to change the person's way of thinking, help them relax, and then sometimes, if possible, use medication. So, I don't know if we can do panic disorders, or let me get some views, or we do that next week, so that we can make room for interactions, questions, and answers. So let me pause here. If you have questions or any concerns, we look at it, and if our time will permit, then we look at panic disorder. If not, we'll look at panic disorders on our next meeting. All right, thank you. So please, are there any questions, any concerns? If you have, you can raise up your hands, and then you speak to us. Or better still, you put it in the chat box so that we can interact. And if you want us to continue to, you can also make that comment as well. Thank you. Oh, do I have some audience with me?
Yeah, you have.
The house has been quiet. Okay, so any question, any concerns?
Okay, I have a concern.
All right.
My concern is about the health workers.
Okay.
Since almost most of them, they are not getting that help that we talk of, like the
They are
work
not getting
related.
what, please?
They are not getting the help, the assistance.
Okay. Okay.
For instance, ideally, every facility is supposed to make provision for 8 workforce in terms of their psychological and then the work related issues, hazards. But when we walk
Okay.
into our facilities, we don't see said department. I don't know. The Ghana Mental Health Association, do you have any way forward or something in the pipeline to
If I should understand you well, you are asking if the Ghana Psychological Association has uh, any structures in place to help
correct?
attend
The-
to health workers' mental health. Is that what you are
yes,
asking?
yes.
Okay, so I think with this is a facility based. Some facilities have mental health workers, mental health nurses, psychologists over there. So
Yes.
so this department is open not to only clients, but as to staff too. Okay. So if you have any concerns, that's why I saying that we should feel free and visit the mental health unit or the department. And you definitely be taken care of. Don't feel because maybe going to share my concern, I'll be stigmatized. No, the mental health workers are trained to handle these things professionally. So in at least I know for the government sector, Ghana Health Service, you go to from the polyclinic, even the health centers, we have mental health, community mental health nurses available. The health centers, they are there. The polyclinics, they are there. The district hospitals, the municipal hospital, right to the teaching hospitals. We have mental health units across the country. So these provisions are there. And I think currently too, we are having these employee assistance programs at various workplaces. The employee assistance programs are established to help workers who are going through some forms of mental health difficulties. So if your facility have that unit in place, they are also available to take care of you as a staff when it comes to mental health needs. So we can explore some of these systems or some of these structures, and I'm sure they will help in that regard. So what Ghana Psychological Association can do is to encourage, to advocate for some of these things to be done. Yes, so I think that is what I can say about that. Madam Deborah Agbevian, your hand is up. Please, you can speak to us.
Thank you.
Good evening, Mr. Tagbor, and good evening, everybody.
Good evening.
Yeah, I have a concern and a question. So the question is, I have a friend who had an accident more than a year now, and for some time he doesn't sleep. His sleep pattern has changed because the thing happened at night. So anytime he wants to sleep, it comes, and then he doesn't sleep. And for some time, unfortunately, he has started using some drugs to sleep. which we are trying to wean him off gradually. Okay, and for such a person, what do we do to him? And the second one too is I want you to elaborate more on the management of the acute stress disorder. Thank you.
All right, thank you. So with this person who had this accident for about a year now, definitely we'll move into what we call post-traumatic stress disorder, which is a condition on its own post-trauma, after some period of post-trauma, at least after 4 weeks or a month of exposure to a traumatic event, individuals experience some of these things. So at that point, it is not acute stress, and it is also not a generalized anxiety, because this is about exposure to a trauma, and it is not acute because of the duration involved over here. So a person like this will actually have to be assessed. One, we get to assess to know the extent of the effects. Yes, the sleep disturbance, yes, is one of the symptoms of post-trauma, as well as all other anxiety issues. The sleep alone is not enough for us to diagnose. We'll have to give further assessment to find out what other things are present that is making these symptoms persist with a person. So that is what I can say about this person. So it will be good this person see a therapist, a psychologist, or any mental health professional to go through assessment. When the person is assessed, then appropriate therapy can be given to help this individual. And I'm very sure with therapy, things can improve. Yes. So it's not about, you see, one thing about when it comes to sleep issues, if there is an underlying mental health issue and you are just using the medicines, the pills, it may not necessarily solve the problem, because taking, let's say, for example, just an example, taking, let's say, diazepam. Diazepam is not going to treat, or diazepam doesn't treat sleep disorders. Okay. Diazepam, it will only help you to get some temporal sleep. But after it wears off the system, whatever is provoking anxiety or the fear, it will continue to be there. So the sleep issue must be dealt with properly. And that is where the proper care and therapy is needed to ensure this person is taken care of properly. So that is on that. Talking about management of acute stress disorder, yeah, so as we are saying, with acute stress, the individual has been exposed to a traumatic event in a short while. And this traumatic event is making the person react, bringing up those anxiety symptoms. Okay, so we are saying that we are focusing on helping the individual manage the situation, compared to generalized anxiety, where the person is worried about almost everything about his or her life. This person, the worry is actually pointed to the trauma that happened, what they've seen, either directly or indirectly. So based on this, when we are assessing the individual, the person can present with almost all the symptoms. Even some people can go to the extent of even hallucinating, but you realize that it is based on the trauma that they experience. So when there are psychotic things present, yes, you begin with the medication, the psychotropics. You will begin with those ones and ensure that the psychotic symptoms are resolved or subside. Then you continue with the trauma-focused therapies. So basically, that is the management aspect. Then the individual too, you have to get to know about your symptoms, get to understand. You see, one thing about, we mentioned the very first thing about the management is that when you get to know that what I'm going through is not healthy, and this is why I am going through this, it helps you to start looking for better ways of coping. But if you don't know that my anger outburst is out as a result of the exposure to this traumatic event, you may be getting angry and it looks like a normal, and you may take it as, for me, I get angry easily. which may not necessarily be so. And then sometimes too, maybe there may be an already existing trauma that is there. So I think those who were with us in our last discussion, we discussed emotional healing. Sometimes when one is not healed from a past trauma, it interferes with their daily activities. So when a new traumatic event comes to add up to it, it explodes the whole situation. So it is good to be able to heal or recover from existing trauma so that when new one comes, even it helps us to even build resilience sometimes. So that is what I would like to say about that. Thank you very much. But if someone has additional information or contribution, the person can do so. In the comments, okay. Please, what is the difference between genetic predisposition and family background as risk factors to generalize anxiety? It's okay. So talking about the genetic predispositions that we mentioned. So let's say, for instance, maybe one or both parents had a mental health related issue or an anxiety issue, and you are born with those traits, so that your genes, you've inherited a gene of that disorder. That's what we're talking about, genetic predisposition. So genetically, you've been exposed to the condition. Family background, sometimes family background, upbringing, the kind of upbringing that the individual even received from growing, the kind of parenting style that the person received, and some other family histories, maybe some auntie, uncle, some issues that has happened to them before. Sometimes maybe what you are going through, they've gone through similar things before. So sometimes it may not be that maybe your direct parents have experienced those things, but if you trace the family history, you realize that at some uncle or some nephew somewhere, some grandparents somewhere might have experienced this before. So you are saying that it can, from that line, so if you take a family genogram, you realize that maybe the individual is inheriting this thing from that side. So it's just the upbringing and the social factors in the family setup can all be seen as the family background. Even socioeconomic factors can equally be here. Poverty, parenting styles, all these issues. Parents who are threatening, and all these things can contribute to family background of an individual. So I don't know if that answers, but if somebody also have a contribution to make to that, we are open to receive that. And if there's a follow-up question too, please feel free to ask. Salom, that was your question. I don't know if I've responded to you. All right, Salom says thank you very much. Patience, your mic is on. Do you want to speak to us?
Please no.
All right.
I'm doing the fitness. Okay.
Okay. Emmanuel is asking for the slide. With this slide, because I have all the presentations together in it, I'll release it when we are done with the anxiety disorder series. So for today, I can't assure you of getting a slide because I have all the other disorders there which we are yet to talk about. So for today, I'm unable to share the slide. When we are done, it will be shared. So we will join us next meeting and we'll continue from there. Okay, there are no questions in the chat box and there are no hands up. So should we call it a day? Millie, your hand is
Yes.
up.
Good evening. Thank you for the presentation. My question is, like someone asked, how to have an assessment. When they come, what form of assessment do we give them? Is it a mental state examination, or what kind of assessment should we take?
All right, thank you very much. So you see, when it comes to assessment, there are different categories of assessments you do before arriving at diagnosis. So we have what we call the clinical assessment. The clinical assessment happens to do with the assessment you're able to do, the interactions you're having with the individual, how the person was before you, the things that for your discretions you are able to deduce. That's the clinical assessment. So you do those ones, and that is what to bring also the clinical impressions. Then we have the mental state examination. So under the mental state examination, that's where you also go through the various structured to see the person's perceptions, thought patterns, behavior, mood, and all those stuffs. I think maybe when we want to talk about assessment, we look about those things into details. So the clinical assessments are there, the mental state examinations are there that you have to do. And sometimes you maybe want to do some other physical, maybe examinations, maybe some labs and other stuff, the scan and all those, the neuro imaging, all those things are part of assessment that can be done. So assessment is based on what the client is presenting to you. We also have the assessment tools that we use, or the assessment test tools, questionnaires, standardized ones that we use. So let's say, for instance, and one common assessment tool that you will see in a mental health unit is the DAS-21. So that form, for instance, DAS-21 measures depression, it measures anxiety, it also measures stress. So you can also subject the individual to that assessment too. We have, specifically for generalized anxiety disorder, we have the GAD-7. We have the generalized anxiety disorder questionnaire. The GAD-7 is there, which is designed purposely for generalized anxiety disorder. You can also administer this test to the individual, where based on their scores, you interpret. So it depends. You have the patient health questionnaire, which is also there that you can use for the individual. So based on what the person is presenting, that will inform the kind of tool you are going for. So use the assessment tools, that is the standardized assessment tools. You use that. You also use the clinical assessment, then the mental state examination. All this comes together to now give you a holistic view of your client. Then you can come at a diagnosis. So the diagnosis, basing it on what the assessment is telling you and what the diagnostic manual is also saying. Then you look at other differential diagnosis too. But I think you are not in assessment class today, so that is what I can say about that for now. Thank you.
All right. I was asking this question with regards to having other health workers working into our unit for just a general mental examination like
Okay.
you recommended.
Okay.
Uh-huh.
Okay, so with that, so one, you can use the standardized tool for the
Mm,
individual. Okay. You have intake assessment forms there. So
mm,
if you have a standardized intake assessment, you can give
mm,
this to the individual. The person responds to the intake assessment. Then maybe when you review the intake form, there may be some interest areas that you may want to find out more. Then you now put in the standardized assessment tools where they go through them. So you can do that, or you can just go ahead with the standardized tool based on the response. If the person is scoring high on a particular parameter, you then go into it and want to find out more to help the individual.
Okay. Okay, so last one. I believe we have health workers on this platform. I want them to know that the mental health unit is not only for psychiatric conditions, but it's
Definitely.
for every individual. Just as you go for your BP check, your weight check, it's also for everyone as such. So the stigma should be dealt with so that we can also always feel free to enter any mental health unit for any form of check. Thank you.
Yes, thank you very much. And that's very, very health workers, we stigmatize ourselves a lot too. A lot. It's something that is there. So it will be even before somebody will seek health care, especially when it comes to mental health, they want to go to a different facility than the facility they work, because they feel somebody will say, hey, in quotes, you two have trouble. But let us make our environment conducive so that everybody will feel free to assess him or herself. It is okay not to be okay sometimes, okay? We are humans. Something can make you to become anxious. Something can make you to become depressed. So when these things are happening, that shouldn't make it look like you are superhuman. Just as you can walk to the OPD and seek healthcare in your facility, the same way you should be able to walk to the mental health unit and seek help over there. And we are there for each other. So we shouldn't be self-stigmatizing. Let us be open. And I'm sure God will also help us. Thank you. I saw some hands up earlier, but they are down now. I don't know if their concerns have been addressed. Norbert. I don't know, but your hand was up earlier. Okay, Sally.
Hello.
Okay,
Hello.
Norbert, come and Sally will talk later. Yes, Norbert,
Hello.
I am.
Yes, please. Good evening. Thank you for the opportunity given. Please, I would like to know whether can we use GAF to assess someone who is going through anxiety disorder, and how does it use? If yes,
Are you
how do
asking of?
we?
Are you asking of
Yes,
GAD? Asking us DAS,
GAF,
GAD,
GAF.
GAD 7.
That's GAF, GAF. That's Global Assessment of Functioning, to assess someone who is going through anxiety disorder. How?
So the parameters on that, is it an assessment form you are familiar with? Is it an assessment form you are already familiar with?
Well, I don't know how to use it, but I learned it's outmoded, but others still use it in their facility settings to still rate how people come out with the condition of mental health and what have you. But I don't know how it is used. That's why I asked for
So
whether.
you see, that is where the challenge is. So talking about assessment, for you to even use a tool, you must first have upper hand understanding of the tool, what it is used for, how to even score, and how to interpret the score. If you are not sure about it, and you go and use, you maybe end up misinterpreting the scores that you've generated. The questions may be there, all right, but how you score it. So I would rather suggest that if you're in the mental health space and you want to use an assessment tool, let us use tools that we are familiar with, that we know we know the objective for that assessment tool, we know the scoring, how to score it, and we know how to interpret the scores properly so that we do not do a disservice to the person we want to help. And you should have training to use the tool. So as I say, you are not very familiar with it, which will mean that you may have to
Okay.
get training for it. So that is what I will say. If you don't have training for it, it is not a must. I'm sure there are other tools that can easily be used. All right, thank you. Sally.
Yes, thank you, Mr. Jones. So, one other thing we can do in our place of work, like the health
Thank
facilities, is
you
to do some
very
more
much.
advocacy. Where I work, I've noticed that usually the clients are more like referred from the doctor's end and all. But if we also do some kind of awareness in the various units of the facility, it helps people to know that we are there. So our own efforts are becoming visible. And then when it comes to the clients that we deal with, especially those that we work with, like the nurses or doctors, other people other than those of us in the psychiatry or psychology units, I've noticed that their challenge is coming to talk to us when they know that next time they'll see us again. Because I once handled a client that was a walk-in case, and she said that she has been hopping from one place to the other because once she approaches a therapist or psychologist and presents her problems to the person, she feels uncomfortable going to the person again because it's like once the therapist sees her, they'll know that this is so and so who came to tell us about their problems. So what I did was to, reassure her that as part of our profession, confidentiality is a big deal in it, and we'll go at her own pace, and that they should have to come a few times to see whether it's working for her. But then the initial interaction was to make sure that I wasn't, my body posture and my mannerisms were not suggestive of somebody who was judging her, because they watch everything that we do in the consulting. They watch how we relate when they say something, how we face changes or our body shifts and all. And that also puts them in a position where they decide whether it's worth coming again or going away with their problems. So we've done about 3 times, and she's comfortable to come for a few other sessions. So for our colleagues that we work with, this difficulty they have is seeing us again after presenting their problems to us. So we have to let them know that, look, their issues are safe with us, and we should carry ourselves in ways that convince them or make them feel comfortable coming to see us in subsequent times. Thank you.
Yes, thank you very much. And it's very, very true. So how we also carry ourselves in our various facilities is also important. You should be someone who can be trusted. If you are not somebody who can be trusted, people will also be scared of coming to you. If you are the one who will easily talk about a client who has just left the consulting room, and if you do this thing to me, next time I know that if I also bring my issue, by the time I go out, you'll be discussing me behind. So the profession says that we should keep client information confidential. So we should always visit our ethical code when we are handling our colleagues. Confidentiality is very necessary for us to uphold, and that can break that barrier where our own colleagues find it difficult approaching us because they feel their information is not safe with us. But I think at a large extent, mental health workers are trained to keep information confidential. So I think I will say that our people work professionally. So if you have any concern, feel free, because psychologist is a must for you to uphold your ethics, which confidentiality is a serious thing in there. And our psychiatric nurses as well, I know they also uphold these things. So if you are a health worker and you do not respect this, know that you are going or you are violating your code of conduct, and it can be used against you. So let us all practice professionally. And how we relate to our colleagues too, it should be in a way that they can trust and get to us or come to us with their issues. Thank you very much. Please, are there any other concerns? Okay, so today we will be ending over here. Today we did one, that's generalized anxiety disorder, and we also tried to differentiate it from acute stress disorder. Next week, Sunday, we will continue with panic disorders. Yes, we'll do panic disorders, and from panic disorders, we'll look at social anxiety disorders. So it's a series, so it will continue that way. So next week, Sunday, God willing, we will continue. And as I mentioned, the slide has the other topics we are going to present. So today I'm unable to share the slide, but we will share the recordings with you. Please, are there any other concerns? Have I responded to the concerns? Okay, there are some comments here.
Please, when will we have the slides?
So the slide will be given when we are done with the anxiety disorders. So it's a series, and
Okay.
the slide has all the other presentations. So it will be shared when we are done with the last one.
Okay, thank you.
Yes, please. Someone says the midwives need mental health most. Madam Deborah, can you tell us why you think so?
All right. I said so because it's like every day somebody is wailing in your ears, and if you're training, you are exposed to trauma almost every day and almost on every shift. So it got to a time you see that most of them become immune to those things. Do you get it? So I think we need it most. That's my point.
Okay, very well. So maybe we'll have a targeted interactions with midwives, nurses and midwives. Maybe your association can organize, and then we have some of these interactions. Thank you. Okay, so let me also remind you that we have a platform where you can join and you have update of our programs, the Ghana Grows Care Center. So the link to the platform has been shared by Madam Claudia. You can tap on it and it will take you there. When the recordings are ready, after transcribing them, we will post them on the platform so you can easily have access to it. There's a question in the chat. Sorry, I laughed. So Theophilus wants to ask, is it true that most mental health staff's behavior, oh sorry, I think you wanted to say behave. Is it true that most mental health staffs behave like their clients? I've also heard that, but it's a misconception, okay? It's a misconception. Mental health workers or staffs don't behave like they are clients, but we should understand that they are humans. So a mental health staff can equally go through stress. A mental health client can also experience other forms of mental health issues. So it is not that they are behaving like their client. At times too, some of the behaviors that you see as behaving like their client, you see, sometimes you have to get down for the client to understand, or for you to understand the client better. Okay, for you to understand the client better, because sometimes this is a client who doesn't want to talk, somebody with mutism, doesn't want to talk to anybody. So sometimes you have to come down to the individual to enable to get the information that you need from this person. And it doesn't mean that you are behaving like your client. So somebody says in the chat that sometimes, well, so it depends, but I don't think that is actually what it is. It's a misconception. But I think Madam Millicent want to add on to that. So she is a mental health nurse, and I'm sure she can tell us more about that, but I don't think so. Thank you.
Okay, thank you. This reaction always come up, and we receive this from our colleague health workers. But I also want to reiterate that just as a nurse who is attending to patients with DM, hypertension, and perhaps other chronic conditions, don't tend to act like they are patients. It applies to the mental health worker. And we should also know that we have personality traits with everyone. You would be surprised to see another health worker acting weird than the mental health worker that is being pointed at. So just as your patient can suffer DM or HPT, someone who is a mental health worker is not immune to any mental health condition. It could be anyone at all. So perhaps such a person may be suffering any form of mental illness at the time. But then we go ahead to stigmatize, you are acting like your client, not knowing that the person is having a problem or a challenge at the time. If we would be able to identify this and have a change of mind towards what mental health is, I think we will stop this pointing and then picking up, especially on mental health workers, that they behave like. That is why we can't have our own health workers come to the unit for any form of assessment. So just as any other health worker can experience or have diabetes or hypertension or any other condition, any other health worker can also equally experience any form of mental illness. That is what I have to add. Thank you.
Yes, thank you very much.
Thank
So
you very much. Thank you.
I think we should all learn from here that so if you have that mindset, I think from today, let us learn to unlearn that mindset that mental health workers behave like their clients. You're actually stigmatizing us. Yes, there are words that will demoralize the mental health worker. So let us avoid that. It is not healthy, and it's not fine of us to be saying things like that. So the mental health worker is also a health worker, just that they are specialized in mental health care. So I don't know whether people who are going to specialize in mental health care must first be diagnosed of a mental health condition before they go into the studies. No, that is not how it is. So please let us stop stigmatizing mental health workers that they have issues. As we said, they are also human, so they can equally fall victims. They can become clients to mental health issues at the same time. The same way the general health workers can equally have issues. So let us stop stigmatizing the mental health workers that they behave like their clients. So I'll ask that. So which of the conditions do I behave like? All right, that is just on a lighter note. So I want to thank you all for joining us this evening, and God willing, next week. So if you're on the platform, when we are about to start, we'll let you know. We'll put the link over there. When our links come, to share with others so that they get the information. So next week, we'll be looking at panic disorders. We'll also look at social anxiety disorders, then maybe we may start with the specific phobias. Yes, so we have a lot at stake, which we'll do next week. So I can see all of you in the chat box. I can see my boss SY, Ahosu, Mr. Seth, Amewo, Ike Mawena, everyone. I've seen you and we appreciate your presence. June Okran, you've been seen. Jenny and every other person. I think if I want to go through the list, we are not ending now. And thanks to all those who contributed, those who shared their views, and those who asked questions to make the session interactive. God willing, next week, Sunday, we will continue with our presentation.
God bless you too as well. Thank you very much.
Amen.
Thank
All right.
you.
And Madam Millicent, I've seen you. Thank you for coming.
All right.
All right, so it's a bye from me. And Madam Claudia, I don't know if you have anything to say. Sorry.
Oh, no, I'm good. I'm good. I'm good.
All right, thank you very much.